Welcome to AETCM, the Emergency Medicine Channel. Today we are going to discuss about poisoning by Paraquat. Shall we start?
Yes.
74-year-old female presented to ER with vitals were stable in the initial triage area. All the signs like airway was patent, sir, and breathing normally with a saturation of 95% at room air with respiratory rate of 25 per minute, and circulation wise her BP was 130. Her BP was 190 by 80 mmHg and pulse rate was 85 per minute, sir. And disability wise GCS E4, V5, M6, pupils 2 mm bilaterally reacting. Exposure was, temperature was normal and GRPS was 150 mg per DL, sir. Coming to the secondary survey, sir. Basically, the patient had presented to had an alleged history of deliberate self-harm by ingestion of the Paraquat, which is an herbicide, which was ingested around 5 p.m. and along with the Paraquat poisoning ingestion at 5 p.m., she even had taken her own medications for hypertension, which she was on, which is nebivolol and nifedipine, 10 tablets each, and zolpidem also 10 tablets. After consumption of such medications, she had multiple episodes of vomiting, by which she was taken to a local by nearby hospital, sir. The primary management was they had done decontamination by putting in a large bore Ryle's tube Foley's and giving a thorough gastric wash and collecting some gastric aspirate. As the patient has ingested such high doses of...
What is the indication of gastric lavage in toxicology? Where all it is not useful, where all it is useful?
Usually gastric lavage is useful in places where the amount of time to take for absorption is more, or which is absorbed by gut, mainly which are absorbed by gut to wash, so that it will reduce the absorption rate, so we can give a gastric wash initially.
In 1 to 2 hour patient will
Except acid and alkali, everything you have to put a
Ryle's tube and
tube. It is not Ryle's tube, it is gastric acid tube and aspirate and try to remove the content from the stomach within 1 hour if they come. That is the ideal situation. But which all condition you can do this gastric lavage even after 1 hour.
If suppose that there can be extended release substances, if there in that cases it will be reabsorbed multiple times, so we can...
Suppose you take large quantity of poison, suppose extended release tablets, or if you have taken some toxin with alcohol, so all things delay the removal of... Okay. So in that condition, you can probably try even after 1 hour, but normal condition, normal situation, with after 1 hour, it may not be effective. That's all. You can try, but it will not be effective.
So in this case, the local hospital had given a thorough gastric wash and collected some gastric aspirate and referred her because she has consumed a huge amount of medications. On arrival to our hospital, the major...
What is the importance of this gastric lavage? Why you are keeping a sample?
It will be used for toxicology report scan and also for in the legal system for to prove anything.
There are two important things. One is for analysis, what is taken. That is very important. Second thing is, even if a patient dies, you have to keep it for a longer period because it is already become a police case, medico-legal case. So we have to keep the sample for a longer period.
Yes. So on arrival to us, her BP was on the higher side, sir, 190/80 in the primary survey which we had seen. But as per the history, she had taken one beta blocker and also a calcium channel blocker in huge quantity.
Okay.
So initial, that's the reason we had not used any medication to reduce her BP, because alleged history of ingestion of drugs which can cause severe hypotension. Okay. So further, as this case was a case of Paraquat poisoning, it is advised that within the first 4 hours, hemoperfusion should be started for this patient. So in this patient, within the first 4 hours,
what hemoperfusion we have done?
We use here charcoal hemoperfusion, sir. Charcoal hemoperfusion, because charcoal has the property of adsorption and it can absorb the toxins here. Okay. Regarding gastric decontamination in case of Paraquat poisoning, charcoal as such has not any proven role, because Paraquat as such has a faster absorbing capacity from the gut. So because it's quickly absorbed and it is highly toxic, there has been no documented evidence using.
How do you clinically know that it is Paraquat?
Clinically, the Paraquat poisoning within the first 6 to 12 hours, there is no
smell will be there. It is very difficult to know from this study.
Also, clinical signs and symptoms within the first 6 to 12 hours is rarely seen, sir.
Oral cavity?
Oral cavity, there can be like ulcers can be seen.
Okay, that is very important. Like if you take acid or alkali, you can get oral cavity ulcers. But this is one poison which is neither alkali or not acid. Maybe I don't know. It may contain acid or alkali, but directly it is not alkali or acid. But that produce severe oral cavity inflammation, ulcers, all these things immediately after toxin. Okay, so you can check the oral cavity for any lesion.
So regarding the pharmacology, Paraquat is actually a bipyridyl compound, which is by the action of redox cycling, where the multiple enzyme repeated mediated cycling will happen. Because of these many coupling of the cycles, there will be a lot of free radical generation in this. So the places in the body where it is highly oxygen dependent or energy dependent is the first places where the injury happens, which are usually the lungs, kidney and the heart.
Okay.
Next, regarding the kinetics, the poison itself cannot cross across the intact skin, so inhalation or droplet absorption is less. Most commonly it is absorbed from the gut. That is the most common absorption, and it affects majorly the places where the oxygen rich because of the production of the free radicals.
This is used for what in farmers?
Herbicide. It's a herbicide. Used.
Okay.
Usage is because of herbicide. Next, as in case of paraquat poisoning, also we have normograms.
So only thing what you should understand is freshly brought paraquat is more dangerous than very old. Some farmers they keep it for a longer period, maybe 1 year, 2 years. The potency will slowly come down. Whereas freshly prepared or freshly brought paraquat is highly toxic. Okay, that's why some patients deteriorate very fast. Some patients may not deteriorate because the potency might have gone completely. Okay.
Like normogram, even for paraquat poisoning, we have normograms defined by foot line and Schemmer's extension, where after 4 hours of ingestion, if we take the blood sample, from there we can plot the line quantitatively which is present in the blood. But in case of paraquat poisoning, quantification of paraquat in blood is costly and not useful, just because within the 6 hours the action will be onset, and even though we determine that there is paraquat of this certain level, there is no specific treatment. So paraquat usually is diagnosed by seeing whether it's present in urine or not.
Okay.
Urine identification is the most important thing. So initial first stages of treatment, first thing what we have to do is stabilizing the ABCDs. As in the case of the patient was stable, only the BP was on the higher side. As the patient had taken multiple components like beta blocker and CCB in calcium channel blockers, initial after 6 hours, as still the BP is persistently high, then we
Suppose you have beta blocker toxicity, how do you manage? This patient does not have beta blocker toxicity, rather he has got high BP, tachycardia and all.
Maybe because of vomiting that beta blockers and that did not go.
Okay. So how do you manage beta blocker toxicity? How do you manage calcium channel blocker toxicity?
For calcium channel blocker toxicity, the major symptoms would be having hypotension, profound hypertension, and there can be hyperglycemia in.
There are two types of calcium channel. One is rate increasing calcium channel, other one is rate limiting. If you take nifedipine, what will happen? More tablets, some maybe 10, 20 tablets, what will happen?
Majorly it will cause hypertension,
cardiac failure. If you take diltiazem,
they will cause bradycardia. PR interval will be long.
Bradycardia and cardiac failure. How do you manage? What are the treatment options for that?
Initially, we would be giving crystalline solids. Anything of shock, first is to be giving fluids. Next, we will supplement with IV calcium. Either we can give as bolus doses or an infusion doses. Next component would be giving glucagon, because it antidote, and then giving high doses of insulin and glucose for if their patient is going into
hypertension. How do you manage?
Hypertension, then we have to start with vasopressor, inotrope.
Okay, you can start dopamine. That will be a good choice. But noradrenaline also can be given, but dopamine has got a better edge over all these drugs, at least in this condition, because some patients will have bradycardia and hypotension, like a patient on diltiazem, taken diltiazem or verapamil, they have severe bradycardia with hypotension. So in that condition, dopamine has got a better value than other drugs, but even noradrenaline is also equally effective. Okay.
And finally, right now present in CCB antidote is IV lipid emulsion therapy.
Lipid emulsion therapy. Okay.
With that also we can try, as in we do local anesthetic
Okay.
poison.
Beta blocker poison.
Beta
Toxicity.
blocker toxicity, same. First we have to prevent the hypotension. Even if it is bradycardia, then atropine dosing can be given.
So almost similar type of treatment in both in calcium channel blocker.
Hypoglycemia in beta blockers and hyperglycemia in CCP.
Okay. Here also you can give glucagon.
Yes.
Here also you can give noradrenaline or dopamine infusion. Some patients can go to complete heart block. Pacing can be done. Okay.
So at this point, like in this patient, because of paraquat poisoning has been determined because we got the photos. Initially, because we didn't have the urine paraquat poisoning, as we have a clinical history based, we have started with hemoperfusion, charcoal hemoperfusion for adsorption. Again, we had done 2 sessions of charcoal hemoperfusion, but slowly the patient's renal parameters were worsening, create getting increase in reduced urine output. So one session of hemodialysis was also done. Next, the patients started becoming hypoxic. So in paraquat poisoning, once the patient started getting hypoxic, if saturation falls below 90%, we can supplement with oxygen. But oxygen itself is we should not be providing, because oxygen itself will increase the production of free radicals in the lung, and further fibrosis of the lung parenchyma will be seen.
So this is one condition where the lung damage is occurring, but you cannot start oxygen like other conditions. You have to preserve the oxygen till last. If the patient is deteriorating in lung parameters, then you have to definitely start. But initial phase, better to avoid oxygen.
And in such cases, when lung condition is deteriorating and oxygen is required, then we can consider giving a palliative kind of treatment where we start with IV opioids on a infusion scale, so that the amount of her pain can be leveled.
Okay.
In this case, initially the patient saturation was maintaining above 90%. We had done 2 sessions of hemoperfusion, charcoal hemoperfusion, and even hemodialysis. Later, the saturation started
In this
dropping.
condition, you can get both kidney damage, liver damage, and lung damage. Everywhere fibrosis occurs. Okay.
And then here we had to start with her in oxygen because saturation was dropping.
Okay.
Later, in this case, we even tried giving her antifibrotic agents like pyrifenidine.
So you can try steroids, you can try like cyclophosphamide, newer antifibrotic drugs, but the mortality rate is very high in real paraquat poison.
There were RCTs comparing the various anti-inflammatory action in paraquat poisoning, comparing dexamethasone, cyclophosphamide, and acetylcysteine in various combinations.
Okay.
But only dexamethasone has proven its any usefulness. Others have been questionable as such.
That is because dexamethasone is one drug which immediately acts. If you start any other drug, it takes some time to act. Dexamethasone immediately acts. The problem is immediate here. That's why.
So further, the patient was, because of her desaturation, was provided oxygen.
Okay. So they'll have high mortality. Most of the time patient will die because of this paraquat poison. Unlike other poisoning, the mortality is very high here.
Other important point is to involve the legal, because it's a police case, it should be informed immediately, as this patient can be expired.
Okay, so if possible, dying declaration should be taken early itself, because you should know the mortality is very high. So inform the police as early as possible. Anyway, we have to inform the police. We have to make it a medical legal case. But this paraquat poison is one poison. It has got a very high mortality comparing with all other toxins we come across. Anything else you want to add?
Nothing else.
Nothing. Okay. Thank you.